We'll give people a couple of minutes and then we will kick off.
Sounds good to me.
Should have some nice waiting background music for everybody to join. Hi to everybody that's joining. We're going to get going in just over a minute, so just stay tuned. Give people a little bit longer to join and then we can kick off. Okay. I'm sure we'll get a few people as I'm doing intros, but welcome everybody. Thank you for joining us today for this quick Q&A session with This Way Up. I am Anna Maltbarrow. I'm the Chief Customer Officer of Westfund. And joining me today, you have Alexandra Blakely, who's going to be helping us work through your questions and answer any of the questions that you may add in our chat today. Please feel free to do that throughout the presentation and hopefully we'll have time to answer them all. We at Westfund launched our partnership with This Way Up a few weeks ago because it gave Westfund members access to their clinically proven online programs. We did it because we wanted to address a growing unmet need from our members across the cities and the regions, across all age groups. Our members were telling us that mental health was one of their top priorities and that they really needed support in finding help. So fast forward to today, and we've had a really wonderful response from our members. So many have signed up and given this new thing, therapy on demand, a go. But we've also had a lot of questions, which is completely to be expected. And it's why we are here today with This Way Up to answer some of those questions people have on, what is therapy on demand? So joining me today, we're very excited to have Katie Dobinson. Katie is a clinical psychologist based in Sydney. You can find her at the Clinical Research Unit for Anxiety and Depression and This Way Up at St Vincent's Public Hospital. She provides cognitive behaviour therapy to adults presenting with a range of anxiety disorders and depressive symptoms. Katie's career has been centred on the treatment of anxiety disorders and working with consumers and clinicians to help them integrate digital mental health into practice. We are so pleased that she can be with us here today and provide an overview of This Way Up's programs and to help us answer some of the common questions people have when considering whether This Way Up is right for them. Welcome, Katie.
Thank you so much, Anna and Alexandra. It's lovely to be here today. And hello to everyone that's listening in. It's wonderful to have this chance to be able to tell you all a little bit more about the digital mental health treatment programs available through This Way Up. I'll be running through a few different slides that I hope can answer and address some of those questions that you might have about how these programs might be helpful for you, but we'll also have some question time at the end if anything else pops up. So as Anna said, my name's Katie, and I'm one of the clinical psychologists that works at This Way Up, based in Sydney. And just before getting into the content of today's presentation, I would like to acknowledge the land from which I'm based on and speaking to you from today, which is in the Eora Nation, the Gadigal people of the Eora Nation being the traditional custodians and owners of this land. I acknowledge that they have occupied and cared for these lands over countless generations and celebrate their continuing contribution to the life of this region. And also thinking about the land that you might be tuning into from today as well. So just to get us started, rather than me talking about my experience using This Way Up with many different people, I'd like to share with you someone else's words. This is from a woman who used one of our programs, who was based in inner regional Victoria some time ago, sort of during the COVID lockdown period. So she contacted us with some feedback and mentioned that she'd started, in her words rather, I started the Worry program as a result of a personal crisis. My husband left me after many years with no notice, and it would take 5 weeks before I could speak with a psychologist. The program helped me through a very dark time in my life. When there was no one to help except the grief line, this program was my go-to resource for getting through one day at a time. It's structured to provide assistance to people like me who are doing it tough, coping with anxiety and worry in their own at home. And on the next slide, you can see what you would expect to see if you jumped onto your phone, tablet, or laptop computer to have a look at the This Way Up website. Now, this is where you'd go to learn a bit more about the treatment programs available and also to get started with them. You can see that the program drop-down tab up the top there is where you would be able to get started. There's also a range of other resources and tools that you can find all freely available at the This Way Up website. So what actually are the This Way Up treatment programs? It's important to, I guess, express that they're not just individual tools or sort of little pieces of information. They are actually a full treatment program, a full treatment intervention that are all based in cognitive behavior therapy. So it's much like the intervention that you might have if you're speaking one-on-one with a counselor or a psychologist, but the intervention is actually delivered through an online program where you read through narrative slides with characters in them. You learn about their mental health journey, and you're taught and you learn practical skills that are evidence-based to help you manage and overcome symptoms of anxiety and depression. So if you're not familiar with cognitive behavior therapy, which is totally fine, just to reassure you, it is the gold standard evidence-based treatment for anxiety and depression and a range of other mental health and wellbeing issues. CBT is a really structured, practical, skills-based type of therapy, and it helps you to identify unhelpful thinking patterns and unhelpful behaviors that might be maintaining difficult emotions, keeping you feeling quite stuck and low or anxious, and gives you really useful practical tools you can use to address those and to start feeling better. On this slide, we've got a list of the programs that are available through This Way Up. So if you just have a quick look there, you can see that there's a few wellbeing programs, but we've also got a large range of treatment-specific programs for certain types of anxiety issues. For example, social anxiety, panic, health anxiety, OCD, and also depression, as well as a range of others. And one of our most popular programs is our mixed depression and anxiety treatment program. And this is because most of the time it's more common than not for someone to be dealing with both of those things rather than just one. Very happy to answer any questions you might have about each program later on. Here, I just wanted to give you a bit of a feel for what you'd expect if you were working through one of the This Way Up online treatment programs. So as I mentioned, you'll meet characters. There's usually a couple per treatment program. That character is facing the same difficulties, whilst of course your own life story and your own experiences are going to be unique, and your own individual circumstances. Hopefully you can relate to some of the challenges and some of the symptoms that these characters are experiencing and follow through as they learn to understand their mental health difficulties and then learn practical tools to overcome and treat them. So it's a nice way to sort of learn about what's happening for you through someone else's journey. Just to speak to why people do choose to use This Way Up, we are a unique treatment service available that's got lots and lots of research and evidence behind it. So we're a non-for-profit organisation that is a joint effort between the University of New South Wales as well as St Vincent's Public Hospital in Sydney. So the treatment programs have been designed by clinical psychologists and psychiatrists with lots of specialisation and expertise in these areas. And there are a large number of randomised controlled treatment trials that show the usefulness and the effectiveness of these different treatments. And we also have lots of people, including individuals struggling with their mental health or wanting to improve their wellbeing and mental health, as well as clinicians that use the treatment programs. These numbers are probably even a little bit larger today. So if you're interested and curious to get started with one of the This Way Up programs, you might be thinking, well, there's quite a few. How would I pick the one that might be right for me? The good news is through the website, there are a couple of really helpful quick tools that you can use to point you in the right direction. So one option is using our Take a Test tool, which is an online anonymous sort of self-report questionnaire where you're guided through a few different questions that will ask you about how you've been feeling and various symptoms of anxiety and depression. It will then recommend for you a treatment program that might be most helpful for you with the difficulties that you'd be experiencing at the moment. So that's a really helpful tool to use. You may already have an idea yourself as to I'm struggling more with my mood and feeling low, so perhaps the depression program might be right for me. Or I'm feeling okay, except that my sleep is very disrupted. Perhaps the insomnia program might be a good fit for you. I also always like to let people know if you are in doubt, you can speak with your GP or another clinician about which program might be a good fit. But generally that Take a Test tool is quite a good place to start. So how do you get the most out of these treatment programs? So I wanted to include a few tips and a few bits of information to help you along the way. I guess the most important thing, like anything that we're trying to learn about, anything that we're trying to address, keeping at it is probably the most important thing. So I'd encourage you to have a look at it initially, familiarize yourself with the program, but then schedule it in the same way that you might if you were seeing a psychologist face to face, or if you were trying to get to the gym twice a week. You might plan ahead of time, okay, this is when I'm going to log in and read the next module and complete that lesson. So that would be my first tip. Secondly, one of the most important parts of cognitive behavior therapy is not just learning about what's going to be helpful, but then actually practicing those skills. So the way that the programs work is you'll read through the sort of lesson slides, which will teach you a few new skills in a week. And then we'd encourage you to leave, depending on what feels right for you, 1 to 2 weeks before doing the next lesson, and use that time to really regularly practice the skills that have been introduced. This will help you to feel better, build confidence, and notice a little bit of a change before potentially feeling overwhelmed with additional information as you move on to the next treatment lesson. Also to let people know that once you get started with a program, it's available for 3 months. Usually it would take people roughly 8 to 12 weeks to get through one of the treatment programs, but there are options to extend beyond that. Absolutely, if you need more time, that's not a problem. And also, once you complete the treatment program, it will remain available to you for another 12 months so that you can go back, review the information, and as a bit of a booster, which can be really helpful. Another tip that I find useful is staying motivated by telling people that, you know, your loved ones, trusted people in your life, that you're doing this treatment program, and they can be there to, as a friendly reminder, as a helpful support, prompt you, ask you how it's going, have a chat and check in if you would find that helpful. Here on this slide, you can see to the right our heat map of Australia. All those little blue dots are where people are located that are registered and using a This Way Up program. So you can see the dots are scattered all throughout the place, and this is one of the most helpful tools about a digital mental health intervention. You don't need to be based where there's physical services. You can access really effective evidence-based treatment as long as you've got internet connection and a device to use that from. The little graph on the left-hand side is just to highlight again the flexibility of an online intervention. So this shows how many people that would be using the online treatments are using them not so much during those 9 to 5 hours, but perhaps of an evening. Now, this is just realistic because lots of us have carer responsibilities, are working 9 to 5. It can be very difficult to get to appointments, let alone wait lists and availability. So this is a treatment that you can access really at any time that suits around your lifestyle and your other commitments. This slide is a brief summary of our randomized controlled trial research that we've completed. So you can see that across our trials, 80% of participants that were diagnosed with anxiety or depression were reporting a significant improvement in how they were feeling. And half of those participants, once they'd finished the program, were no longer reporting being troubled by their symptoms of anxiety or depression. So really, this is just to highlight, we know that it's helpful and we know that it does work. Similarly here, the clinical practice guidelines. So these are the Australian and New Zealand guidelines for mental health practitioners that are treating depression and treating anxiety disorders. And within these guidelines, it's just important to let you know that online cognitive behavior therapy is also included as a gold standard first-line treatment for anxiety and depression. And it's also been found to be just as effective as face-to-face therapy within that CBT treatment frame. So to be reassured that it is, that can be really interesting often for people to learn initially, that it is just as effective as that one-on-one face-to-face therapy. Another helpful benefit of the digital programs is that you can really use them flexibly depending on your own wellbeing needs, your own mental health needs. So some people might use these treatment programs independently, not with any other kind of treatment, and find them very beneficial. Others might use them alongside taking medication for their mental health. Others might use them alongside individual face-to-face or telehealth sessions with a counsellor or with a mental health clinician. So it is really flexible and you can kind of adjust it depending on your needs. Here, I just wanted to highlight some of the other helpful resources you can access through This Way Up. So we have a range of coping tools, which again include some evidence-based skills that you can use to manage anxiety in the moment, to calm and regulate intense emotions. And about 12 to 18 months ago, we had all of our coping tool resources translated into the 10 most commonly spoken languages other than English in New South Wales. So if this is helpful for you, or perhaps family members or friends that English isn't their first language, just to know that there are some of those resources available as well. And this is my last slide. So just to finish with some tips, to summarize that you can feel better and improve your well-being, as well as address mental health difficulties with cognitive behavior therapy, that being the therapy that you'd receive if you were to do a This Way Up program. That CBT is doable, it's a short-term treatment, it's very practical and skills-based, and it can be really empowering to learn that there are things that you can change that will actually improve your mood and increase your overall well-being. I'd encourage you to try the Take a Test tool. It's anonymous, it's free, it doesn't take that long, and it can point you in the right direction of a program that might be a good fit for you. And then lastly, I'd like to just encourage you to log in regularly and take it at your own pace, one lesson at a time, and really practice those skills before moving on to the next lesson if you do give one of the This Way Up programs a go. Okay, thank you.
Wonderful. Thank you, Katie, for all of that. And you definitely have answered some of the questions that came through from our members in advance. So I won't duplicate any of those, but we have a couple more that I will I'll ask you now.
Great.
So one that came through was from a member who said, I don't have any a diagnosed mental health problem, but I'm wondering if This Way Up can help me just to maintain my mental fitness.
Yeah, excellent. That's a fantastic question. Absolutely would be my answer. So often, understandably, we can not necessarily address an emotional difficulty, or perhaps there might not even be something that you're experiencing as a problem until it gets a little bit worse. And I would say it's never too early to, the same way that we would just want to kind of maintain good physical health, we want to try and maintain good well-being. This is really important for our overall health and happiness and quality of life. So I would say absolutely this way up could still be helpful for you. And perhaps where you might like to start would be with the well-being program. So these aren't specific to a certain mental health diagnosis, but they're slightly shorter in length, those well-being programs. They include our stress management program, mindfulness program, and our insomnia program. So take a look at those and see which one might fit for you. We also have a student wellbeing program, which can be helpful for, it's designed sort of for university students, but can also be quite suitable for older high school students too, doing things like the HSC.
Wonderful. While we're on the specific program topic, another question that came through was whether there are any programs that can help people caring for someone who has a mental health disorder.
That's a great question. I would say that whilst there isn't a This Way Up program that's specifically designed to support a carer, carers, where people and we're facing challenges of all different sorts, and being a carer for someone who's dealing with their own mental health issues or otherwise can be very rewarding, but can also be quite challenging and can lead to feelings of low mood or anxiety. So it might be that one of the treatment specific programs is a good fit for you. Again, I'd say have a look at that Take a Test tool. But perhaps also the stress management program might be helpful to bolster just day-to-day well-being and support you. There is, it's not a treatment program, but we do have a range of carer resources available too on the website, a carer-based blog and resource that I'd be happy to link to you later if that's helpful.
Awesome. I think there might have been a chat as well, a question through chat, Alexandra.
Yeah, so this is related to programs as well. Are there any programs for trauma or complex PTSD?
Yeah, great question. We do have one trauma-specific program, which is our post-traumatic stress program, which is to treat PTSD. Importantly, though, and this can be a little bit tricky and confusing initially, but it's not designed to treat complex trauma. So I guess the difference there being for post-traumatic stress, that treatment program is designed for adults who've experienced a traumatic event in adulthood. So it's generally based on a one-off particular incident. So that might be something like experiencing an assault, experiencing a natural disaster, or witnessing something quite traumatic as a one-off incident. The treatment program for post-traumatic stress disorder may be suitable for you in that circumstance. For complex trauma, however, this tends to be when we've experienced multiple traumas that may have, depending on whether or not they've occurred in our childhood or in adulthood, that it's a repeated experience of trauma, and it might be different types. So the PTSD program isn't a suitable treatment for complex trauma. I think we do have a couple of links on the website with information for that. I'd let people know about the Blue Knot Foundation if they're looking for places to go and get information about complex trauma treatment, as well as the Phoenix organization.
Thank you. One last question on the different types of programs. Is there any programs designed to help teenagers going through their own mental health challenge?
Yeah, excellent. Great question as well. We do have one of the treatment programs called the Teen Worry and Sadness program. So this is designed for teens and young people aged between 12 and 17 years. And it teaches them, again, sort of helpful practical tools to learn about and manage feelings of anxiety and worry, as well as sadness and low mood. This treatment program, just to let people know, does require supervision from a clinician, and does also require a parent or a caregiver to be registered to that program too. And that's all due to the current evidence base of knowing that having a clinician and also having parent or carer involvement and awareness is going to be the most helpful way for that young person to recover and improve. I'd also say that the student wellbeing program could be suitable for some older, mature teens that might be doing the HSC or looking for ways to manage stress around study and school.
Awesome, thank you. This question is the similar question that I would ask. Do I need to complete all the steps in a program, and how will I know when it's done?
Yes, excellent question. So most of the treatment programs include 6 modules. So that involves, I guess, 6 different treatment modules. Each will focus on a different skill or a different aspect of, for example, anxiety or depression. Reading through one of those modules online takes usually around about 20 minutes to read through the information. And then there's some practice exercises that you're encouraged to do between each lesson. So you'd know that you'd completed the treatment program when you get to the end of that last lesson and you've read through the information and you've been practicing the skills. You'll also get some automated emails from This Way Up when you've completed each module, and some helpful, just sort of friendly reminder emails to encourage you to keep going or log in if you haven't logged in again. So there's some external help and guidance if, we know life gets busy, and those emails are intended to help support people. What was the other part of your question? Sorry, Anna, when will I know that I'm finished? And
it was, do I need to complete all of the stages of the program, and how will I know?
Yeah, I would say we know that the more modules you complete, the better your response to the treatment will be. So I'd strongly encourage people to complete a whole treatment. Then you'll have received all of the aspects of that treatment, and it's likely that you'll feel that the improvement will be larger than if you do fewer modules. But something is better than nothing for sure. And sometimes people find that after they do maybe half of a treatment program, they're already feeling a little bit better. But my message would be, even if you're feeling better, work your way through to the end, and then you'll have done the whole treatment.
Yeah, wonderful. And I know a question that we've been getting quite often from our members, are there any costs associated with This Way Up programs for members? And I might answer this one. So through our partnership, we've made their programs available for our members on extras or hospital policies, available at no extra cost. This Way Up's actually also available free for people with GP referrals, but we know from our members that even to get in to see a GP in some areas can take weeks, and we feel like it's really important to just help people get instant access if that's what they need. So up until the 31st of December, there'll be no extra cost. You just use the form on our health co-op to type in your details. You'll get a code, and you'll just drop that code in as you register for one of the individual programs. The last question I had, unless anyone wants to put anything more into the chat, is how does This Way Up work alongside my psychologist if I am undergoing sort of face-to-face therapy sessions?
Yeah, great question as well. So I guess this one is really going to differ on a real individual basis. It really depends what you're doing with your psychologist, what it is that you're getting some support from them for, and maybe what type of therapy you're doing with them as well. The way that I use it often in my own clinical practice is it's a very helpful booster for if we're introducing a skill in our individual sessions. I might be working with someone, for example, on looking at really anxiety-provoking thoughts that they're having, and I might work with them on learning to monitor and challenge unhelpful thinking patterns. And then I might encourage them to do a particular module that would map onto that and help reiterate what we've discussed in our session, and give them some practice tasks to go on with. So that might be one example. For other people, it can help to space out therapy sessions with a psychologist. So it might mean that if you're feeling a bit better and approaching the end of your treatment, you might see your psychologist a bit less frequently, and you can use This Way Up as sort of an in-between therapy, which can be quite helpful. Or it might be used as well if you're doing a different type of therapy with a psychologist. For example, some interpersonal therapy where you might be talking more about relationship stress or work stress, but then learning those practical cognitive behavior therapy skills out of your sessions through the This Way Up program. So those are a few examples.
Okay, wonderful. We are at time, but I think there have been a few last questions. So Alexandra, if you can pick one last one for Katie to answer, and then we'll wrap up today.
Yeah, perfect. Okay. So one of the last questions is, does the program have counsellor support if it is required?
Counsellor support, is that the question? Yeah. So really good question. Our treatment programs through This Way Up, we don't have one-to-one clinician support available. So if you're looking for clinician counsellor support, the best way to do that is to have a clinician that you're seeing prescribe the program for you. That way they can monitor and support your progress. But unfortunately, no, we don't have through This Way Up counsellor support available.
Okay, wonderful. Well, thank you so much, Katie, for your time. Thank you, Alexandra, for monitoring the chat. I hope everyone found this useful. It will be recorded and available on our website to view again, and have a great Friday, everybody.
Thanks so much for the opportunity. Have a good day.
Bye. Thank you.
Bye.